So we have the client is now face up and we're going to drape the leg to do some work here. So same thing we did on the back of the leg. I use a barrier so that I don't get any lubricant on the blanket. Use the the lower part of my forearm here, which doesn't have any oil, and I take a short step up. Oops, try that again. Take a short step up. And then that allows us to put the blanket out of the way. Now I can use my hands because we're going to wash the linen. So same thing, we're going to roll the sheet, pin down to the thigh so that the client never feels, you never want to raise it because the client might feel exposed. So you pin it down, take a short step toward the head of the client like so, and then tuck under the opposing leg. Now, many therapists will usually drape to this area, missing some significant muscles, including the tensor fasciae lata, which feeds into the IT band that we had looked at. So I recommend make sure the person is totally secured here and drape so that you can access right around the iliac crest area and you can get into that tensor fasciae lata. And the same as when we were face down, tucked underneath the other leg, the person is totally covered. There's no risk of exposure. So we've put some gel on the thigh and the shin, and now we can get into using the stones. The person is quite acclimatized at this point, but I still want to start with some introducing my touch and then cover the area that we're going to work on, and then I can incorporate the stones. Now, even though the front of the thigh doesn't have the same anatomical delineation as the back of the thigh with the hamstring, you can still pick a midline and do some really good work. By spreading away from the midline and then gathering toward the midline. A lot of times I find people have a lot of crunchies, crepitus in the tissue where the tissue thickens just above the kneecap. So a lot of people appreciate having that area worked, helps to relieve knee pain. Another area that you want to consider is make sure that you've draped and you can have access to that tensor fasciae lata. So we find the anterior superior iliac spine here, and the tensor fasciae lata is in this area. So you can even just hold the stone. Now, as I spoke about earlier, we don't do placement stones, but if you're monitoring the stone and it's only for a short period of time, we're fine with this. We just never leave a stone unattended on the body. So we can work into this tensor, and you're going to find people, especially people who sit at their workplaces all day, this is going to be a tender muscle, and of course it feeds into the iliotibial band, so will cause a lot of pain into the lateral thigh and down into the knee if it's not addressed. And you can do the same techniques we did on the back. So we can do scooping, we can do wringing, we can do spreading techniques, and we can put one stone aside and we can do palmar kneading. So once we treat the thigh with the mid-size stones, I recommend switching to some smaller stones. And we can do some really nice work, working around the kneecap. And as I mentioned, when our client was in a face-down position, just following the joint space along the knee, especially if someone has a history of osteoarthritis, this can give a lot of relief. We can find the shin bone here, and we can work off the edge, come toward the edge. Now the client might find this a little bit tender, but tends to be a lot less tender than using your fingers. Having this broad, again, we're getting an advantage here with the broad surface of the stone. We can rotate the leg a little bit and do some of those muscles on the opposite side of the prominent crest of the shin bone. And we can use the stones to arc quite easily around the outer and inner ankle. Don't forget we have muscles on the top of the foot. We can use a gentle, slower combing technique. This is really helpful when you see people whose toes seem to be almost clawing the earth. You see this kind of contracture. Being able to just work through those with some heat, very helpful. And if you do have an 80-minute session, you've got more time available, you might want to take some particular attention to the joint spaces and the phalanges. And then we can finish off with a set of stones, general, specific, general, just to reheat the leg, and then we'll go on to our other leg. So next we're going to show the arm. I've got some really nice techniques to show you. We can treat the abdomen with stones. Of course, just be careful with pressure around the abdominal area. We're not demonstrating it today, but you can also treat the abdominal area with stones. Heat to the abdomen can be quite comforting. So what I would do here, we've put gel on the arm, and then I will start by incorporating the neck with the shoulder, using a mid-sized stone up in here. The person is fairly well acclimatized, so you're probably okay just to jump right into things. Of course, you could warm up with a set of hot stones if you choose. Now we can pivot the shoulder here so I can get the inside upper arm, and by using the range of motion in the shoulder I can get the outer as well. So we were able to get all of the angles. Another area that you would like to treat is just below the collarbone here, the chest wall. This is another one of those areas in the profession where we require extra level of permission, of consent to treat. So make sure you get permission from the client to treat first to be able to treat these muscles. And what I like to do is just support the arm and use the stone just running along below the collarbone. Pick up my other stone that's still warm. Now we've worked the back of the arm when we were in a prone position, so I'm just going to go right into the forearm. And you can do a technique toward or away from. So we can use a warm stone. I like to use the tool stones, and your clients that happen to be massage therapists or work with their hands in other ways are going to love this, because we can get into the nooks and crannies both with pressure as well as that combing-like technique, and we can get the muscles, the thenar and the hypothenar muscles, quite effectively. And then you can finish off either using a stone as a brace or just your hands. Oops. And finishing off the hand by working the fingers. So we're finishing off our hot stone treatment. There are 2 small circular stones that are available. These are great stones for working in through the cheeks and the jaw. So I like to work below the clavicle and also above. We forget about this platysma muscle that runs from the jaw to the collarbone. We often talk about the scalene muscles, the secondary respiratory muscles behind, but don't forget this platysma muscle and this hammock of muscles below the jaw. We can work through the chewing muscles, certainly along the ridges below the cheeks, forehead, temples, and we can finish by putting the stones down. Our hands are warm and just working the ears. So hot stone massage, with the 50 minutes, you've got about 25 minutes face down, 25 minutes face up. Of course, you can adjust accordingly depending on what the client's needs are. If you find that the client really enjoys the hot stone massage and you just aren't able to get everything you'd like to everything you'd like to work on, ask them next time to come back for an 80-minute massage. That gives you 30 extra minutes of hot stone work, and you can get into all of those tight spots that can't seem to be addressed by a 50-minute treatment.